So when we think about Siteman kids at St. Louis Children's Hospital, you think about kids, right, a pediatric institution. But I will admit the ages that come through our door are anywhere from birth, so right out of the womb for patients that we're treating, I would say almost to 20s to 30s we would comfortably house at St. Louis Children's. And the reason that we would do so is if there's a certain diagnosis that a pediatric oncologist is more familiar with and more comfortable with in treating, sometimes it makes more sense for them to be cared for at our institution if we're able to provide resources that might not be available across the street. Additionally, there are some kids that are 20, but they're actually kids at heart, or kids mentally. And so we have some kids who, I would say young adults who have some developmental impairments or other psychosocial needs where potentially help at a children's hospital that can additionally treat their underlying diagnosis really benefits the whole person and the family. I think what's really important for patients to know is if you're over the age of 18, it doesn't mean that we kick you out the door. We work very closely with a lot of families and kids. I've always loved kids, period. I babysat a lot as a kid. I worked at a lot of camps. When I was in college, I volunteered with kids. I was in a sorority and had big sister, little sister collaborations that we had going on. So working with kids to me wasn't a surprise. I went into medicine knowing that pediatrics was my calling. I didn't, however, know that I wanted to be a pediatric oncologist. And that was my first year in medical school, where I realized I really enjoyed working with kids who were truly sick, who had real problems that were out of their control, and knowing that I could maybe come in and be a beacon of stability during that time for them and kind of guide them throughout. So I was paired in a volunteer program in med school in my first year, worked with a kid who had leukemia, really bonded with her, and then started shadowing within our pediatric oncology clinic that first year and knew right away that that was the place for me. So a child who is diagnosed with cancer may require the help of a lot of different people. So I'm clearly the face of pediatric oncology and tend to be the closest with patients and their families as we go through treatment. But I think what families need to understand is our reliance on a lot of different people to help their child. And I think what we benefit here, and I feel very honored at working at Washington University here in St. Louis, is that a lot of our collaborators are excellent at what they do. And I really trust them to help me out to then help out the patients. And I can't necessarily say the same thing elsewhere. So not only do we have a lot of different people who are very qualified, but we're also on the forefront of clinical trials and research and getting access to certain treatments that aren't able to be offered elsewhere within the state or sometimes even within the Midwest right now. For kids who are going through cancer, sometimes it just helps, and I would say even more our adolescent population, maybe a little bit 8, 9, and 10, who truly are understanding that things are a little bit different for them and why is that and how is this going to be. So we have the ability to pair them with other kids, sometimes similar diagnoses or just similar ages, to help them understand a little bit more. There are a lot of different support networks too, so for parents to understand from other parents what's going through. I think social media has a lot of pros and cons nowadays, but I'd say the pro in our situation is that it can connect people a lot easier. And so we can connect within our community, but we also have the resources to kind of connect nationally to help families out and make them know that they're not alone. So when we think about treating pediatric patients, it's not just the pediatric patient, right? So it's the entire family. It's everybody who's involved in the care of that kid at home. I think all pediatricians know that they go into pediatrics not just treating one patient. They have to be ready to take on the family, to take the family through whatever is going on, and to work with adults who have a much different perspective, educational basis, outlook on life versus the kid who at 4 may be very carefree, at 9 may have some understanding that, hey, something doesn't feel right, something's different about me right now, what's going on, I can't necessarily put it all together, to 11 to 12, who's definitely understanding things more, to 17 to 18 that might start to think they're a little invincible and what do I really need to do to treat the underlying cause. And so I think a lot of us as pediatric providers understand the mental changes within the age range, how we can best support the patient through what's going on, and then obviously knowing that we're here 110% for the family. I have 2 kids at home. I don't think all pediatric providers need to have children at all, but I do think it has given me another layer of understanding of what it means to be a parent who's trying to advocate for their child, who wants to understand what's going on with their child and what they need to do to best help them. So I am very adamant that if we know a result or if we have a scan back, you don't wait till the next day. You pick up the phone and we call and we let you know, because I don't want parents sitting on the other end waiting. I think that people who want to work with kids who have cancer have a special part of them that really opens up to issues in life that aren't fair and that a lot of people don't need to go through. And you can recognize that and you can see it and you can know it's going to happen whether you're a part of it, but that you actually want to be there to influence the outcome or how they feel about it. And so I really see our mission as not only helping patients and obviously striving for a cure, but also helping to really optimize their quality of life and what we're able to achieve during their time period with cancer.